I'm Dr. Neela Mukhopadhaya. I'm a consultant gynecologist and my NHS practice is in Luton and Dunstable Hospital. I do my private work at One Hatfield Hospital and I have weekly clinics here. So menopause is by definition cessation of menstruation due to a cessation of ovarian function. And the word it's very interesting, comes from the Latin word menos, meaning menses, and pausos, meaning cessation. Now, it's determined when a baby is in the mother's womb. So, it would be determined long before you were even born, but there are other factors that will affect menopause. So, if somebody was very small at birth, or they had very low weight gain in infancy, if there's starvation in childhood, in Down syndrome and in smokers, the menopause can be quite early. And the average age in the UK is about 52 years. So it's extremely important to understand menopause, and a specialist care is provided for it. And there are a few reasons for this. As with increasing life expectancy worldwide, it means that women are living a third of their lives in menopause. And it's so important that the quality of life is good. There is a lack of clear guidance about HRT, and even doctors and some gynecologists and GPs are confused with the varied symptoms that patients present with. And it's hence so important that specialist care is sought at the right time to improve that quality of life. In terms of signs and symptoms of menopause, this is something that is so varied. It can vary from hot flushes, night sweats, disturbed sleep patterns, feeling irritable, having short-term memory loss and concentration. Some patients will present with sexual dysfunction, and they could vary from a variety of things like sexual desire disorders and genital pain during intercourse, etc. There are women who would experience psychological symptoms, and that could range from, depression, mood swings, anxiety, irritability, lethargy, etc. Some women even come in with repeated urine infections, so there can be a variety of ways women present with. It's extremely important to make the diagnosis, particularly because making the diagnosis of menopause isn't very easy. There aren't any blood tests that can tell us that you're absolutely menopausal, and there are some restrictions on what tests the GPs can run after the age of 45. But having a full assessment is absolutely vital before HRT is started. So a clinician should establish menopause using history and other investigations. They should review the symptoms and assess for any risk factors such as heart disease or osteoporosis. And then comes the most important part of the woman's view on menopause, and that needs to be individualized. A full discussion of the risks and benefits is so important to allow a patient to make an informed choice. One mustn't forget the contraception needs, because women can still fall pregnant after having had an early menopause. Family history of cancers like breast, bowel and ovarian cancers should be considered. Family history of strokes, heart disease, clots in the legs or chest, they are very important. And if somebody's got a personal history of migraines, that's important, because giving any form of HRT increases the risks of clotting disorders. In terms of treatment options, there are so many varieties of HRT preparations that are available in the market. We get them in different strengths, combinations, different routes. So you could get patches, you can get tablets, you can have injections, you can have it through your nose, you can have vaginal pessaries, intrauterine devices. And again, it's important to give HRT in a way where if you haven't finished your periods completely, you get a different type of HRT. whilst if you've had a complete cessation of your menstrual cycles, then you get a different kind of HRT. So there are various options of HRT available. So HRT is basically hormones like estrogen and progesterone. So estrogen and progesterone are hormones that are produced in your body, and that is from the time you start your menstrual cycles until your menopause. After that time, the hormone levels will drop down, and that's when you start getting all the symptoms like hot flushes, irregular periods, or you may lose your bone strength, your skin density, and other symptoms may appear. Now, the main component of HRT is estrogen and progesterone, and they are generally derived from other sources, but we are starting to get newer ones which are very identical to your own hormones, and they are called the bioidentical hormones. There is a certain benefit of using them in a selected group of women, and that is where all of this discussion about assessing you, investigating you, discussing all the risks and benefits, and then tailoring it to you comes in. Besides HRT, there are other options as well available, and if somebody has the complaints of hot flushes and low mood, they can be given other medication such as progestogens. There are some antidepressants that can be given. Again, for vaginal dryness, etc., there are various moisturizers and lubricants available. If there is a strong family history of osteoporosis and that is the reason somebody requires HRT, then other options of bone strength should be discussed, and there are many different medications available which are not HRT. And of course, non-hormonal options, which we always stress, is weight-bearing exercises, vitamin D, having phytoestrogens, herbal products, homeopathy, acupuncture, reflexology. There are so many other things that can be used in conjunction with HRT or on their own. I have a keen interest in menopause, and I will offer consultations both in the NHS and in the private clinics. So I have a clinic in One Hatfield Hospital every week, and I offer full assessment, investigation, discussion, and the options alongside the risks and benefits of HRT. You can either self-refer yourself, or you could get your GP to refer you to see me. Full details are available on the One Hatfield Hospital website, and also on my personal website www.neelamukhopadhaya.co.uk. Thank you.